Hello friends, welcome to this video. Chapter 5, Therapeutic Approaches. Introduction. When people suffer from psychological disorders, stress, emotional problem or behavior issue, they need professional help. This help is called therapy or psychotherapy. Therapy helps people to understand their problems, change negative thoughts and behavior, improve emotional health, live better life. This chapter explain meaning of psychotherapy, types of therapies, main therapeutic approaches, important technique, role of therapist and client. What is psychotherapy? Psychotherapy is a systematic treatment of psychological problems through talking, behavioral techniques, emotional support. It is done by trained professionals like psychologists, psychiatrists, counselors. Therapy focuses on mind and behavior, not only medicines. Goals of psychotherapy. Main goals are reducing emotional distress, changing unhealthy behavior, improving relationships, developing coping skills, increasing self-understanding. Therapy helps person become more confident and balanced. Factors affecting outcomes of therapy. Therapy is successful when client is motivated, therapist is trained and supportive, good relationship between client and therapist, correct therapy method is used, both therapist and client must work together. Types of therapeutic approach. There are four major approaches: psychodynamic therapy, behavioral therapy, cognitive therapy, humanistic therapy. Many therapies also use electric approach, use of mix of methods. Psychodynamic therapy based on theory of Sigmund Freud. Belief problems are due to unconscious conflicts, past childhood experience affect present behavior. Goals: make unconscious thoughts conscious, understand root cause of problem, reduce emotional tension. Techniques used: free association, client speak whatever come into their minds. This help to reveal hidden thoughts. Dream analysis, dreams show unconscious desire and fears. Therapist interpret dreams meaning. Transference, client transfers feeling of past relationship onto therapist. This helps in understanding emotional patterns. Advantages: deep understanding of personality, long term emotional change. Limitations: time consuming, expensive, not suitable for all problems. Behavioral therapy based on learning theory. Belief problems behavior is learned, so it can be unlearned. Focus is only on present behavior, not past. Goals: remove unwanted behavior, teach new healthy behavior. Important technique: positive reinforcement, giving rewards for good behavior. Example: praising student for good study habits. Token economy, person gets tokens for good behavior which can be exchanged for rewards. Used in schools, hospitals, systematic desensitization. Used for phobias, step relaxation training, making fear hierarchy, gradual exposure to fear, fear reduced slowly. Flooding. Person is directly exposed to feared object. Fear decreases after some time, but is risky and not used much. Advantages. Works fast, useful for phobias and addictions, clear and practical. Limitations. Does not focus on thoughts and emotions. Change may not long last. Cognitive therapy. Based on belief, psychological problems are due to negative thinking. If thinking changes, behavior and emotions also change. Goals. Identify wrong beliefs, replace them with realistic thoughts. Major types. Big's cognitive therapy used for depression, focus on negative view of self, negative view of world, negative view of future. This is called cognitive dread. Therapist helps client think more positively. Rational emotive behavioral therapy. Albert Ellis believe people suffer because of irrational beliefs. Example, I must be perfect always. Therapist change such thoughts, uses ABC model, activating events, beliefs, consequences. Change B to change C. Advantages. Short term practical, very useful for depression and anxiety. Limitation. Less useful for severe mental disorder. Needs active participation from client. Humanistic therapy based on idea of Carl Rogers and Abraham Maslow. Believe humans are naturally good. Everyone has potential for growth. Goals. Self understanding, self acceptance, personal growth, client centered therapy. Therapist does not give advice, provides unconditional positive regard, accepting clients without judgment, empathy, understanding clients' feeling deeply, genuineness. Therapist is honest and real. This creates safe environment for change. Advantages: improve self-esteem, good for emotional problem. Limitation: not useful for serious disorders, no clear structure. Elliptic approach, meaning using more than one therapy method based on client's need. Example, using medicine plus counseling, using behavior plus cognitive therapy. This is most commonly used today. Biomedical therapy. Sometimes medicine is also needed, given by psychiatrist. Types of biomedical therapies or medicines: antidepressant, anti-anxiety drug, mood stabilizer, antipsychotic drug used in depression, bipolar disorder, schizophrenia, Medicine reduces symptoms, but therapy is needed for long term recovery. Rehabilitation and aftercare. After treatment, patient needs social support, job training, family counseling. This help person return to normal life. Ethical issue in therapy. Therapist must follow rules, confidentiality, respect client's dignity, professional behavior, no exploitations. This protect client's right. Role of family in therapy. Family support improves recovery. Family should understand illness, encourage treatment, avoid blame. Family therapy may be used in many cases. Therapy for children and adolescents used for exam stress, anxiety, behavioral problems. Techniques include play therapy, counseling, parental guidance. Early treatment prevents serious problems later. Indian approach to therapy. Indian method include yoga, meditation, spiritual counseling. They help in reduce stress reduction, emotional balance, self control. These are used along with modern therapy. Importance of therapeutic approach. Therapy help in emotional healing, better relationship, self-confidence, mental health awareness, reducing social problems. It improves overall quality of life. This chapter teaches that psychotherapy is scientific treatment of mental problems. Different approaches explain problem differently. Psychodynamic therapy focus on unconscious conflict. Behavioral therapy focuses on changing behavior. Cognitive therapy focuses on changing thinking. Humanistic therapy focus on self growth. Analytic approach combine methods. Medicines are also important in some cases. Family and society play big role in recovery. Ethical rules protect clients in therapy. Therapy is not for weak people. It is for people who want to improve their mental health and live better life. Thank you.